Okay, it is my great pleasure to introduce my friend and colleague in research about the Holodomor for many years, Nataliia Levchuk. She is a demographer whose research focuses on population health, mortality, migration, and the demographic consequences of major social crises in Ukraine. Natalia's research has addressed the short and long-term demographic consequences of the 1932-33 famine in Ukraine, as well as the health and demographic impact of the Chernobyl nuclear disaster. She was a visiting scholar at the Harvard Ukrainian Research Institute in 2013 and 2018 and contributed to the development of the MAPA, Digital Atlas of Ukraine, particularly the Great Famine and Chernobyl modules. Her recent research focuses on the demographic consequences of Russia's war against Ukraine, including its impact on mortality and life expectancy, internal displacement within Ukraine, as well as the integration and well-being of Ukrainian refugees in Germany. She has published widely with articles and book chapters appearing in Ukraine and internationally. Please welcome Nataliia.
Thank you very much, Oleh, for your kind introduction. Good afternoon, everyone, and thank you, the organizers, for inviting me. So let me start. The war in Ukraine represents one of the largest demographic shocks in Europe in recent decades. In 1991, Ukraine had about 52 million. Then by 2022, before the full-scale invasion, about 41 million. And the war has accelerated this population decline through mass displacement, war-related mortality, and decline in births. At the same time, measuring these changes is extremely difficult because Ukraine has not conducted population census since 2001, and the annexation of Crimea, the war in Donbass, and the current war actually disrupted population statistics further. As a result, the size of current Ukraine's population is highly uncertain. Current estimates for the government-controlled territories range from 28 to 31 million. So Ukraine lost about 10 million between 1991 and 2022, and possibly lost another 10 million since the full-scale invasion if we consider government-controlled territories. I would like to emphasize that demographic problems in Ukraine didn't start in 2022. Even before the full-scale invasion, the crude death rate was 2 times higher than the crude birth rate, and for the wartime, these indicators are not available, but based on absolute number of births and deaths provided by the Ministry of Justice of Ukraine, we can say that the deaths actually now three times are higher than the number of births. Ukraine also entered this war with relatively low life expectancy and high level of premature mortality, particularly among working-age men. So my key point here is that the war deepened pre-existing demographic challenges, but also created the new ones. And before moving to these new ones, I would like to emphasize one important feature of the war. I think it was already mentioned. Unlike many earlier wars and conflicts, this war is characterized by using high technologies, long-range, high-precision drone and missile attacks targeting civilian infrastructure, and residential buildings. What does it mean for civilians and for population health? This map shows special distribution of aerial attacks across Ukraine. These maps are based on the data collected and reported in a World Bank report, and they show special distribution of aerial attack over time, starting from the beginning of the war up to the date indicated for each map. So the last map on the right shows cumulative distribution of attacks over the last 4 years. What is shown here is that in the first year of the war, these attacks actually were highly concentrated in the areas close to the front line. But then over time, they actually they spread across much of the country. And this means that civilian risk is not anymore, no longer confined to areas close to the front line, but the war exposure and its demographic and public health consequences actually now increasingly nationwide. This broad geography of the war exposure is also reflected in casualties data. UN Human Rights Monitoring Mission in Ukraine reported that long-range attacks using missiles and drones are the main cause of civilian casualties now, while short-range drones and artillery strikes are the second cause of civilian casualties. The UN verified about more than 15,000 civilians killed and more than 43 civilians injured. These are only verified, confirmed cases, and in all reports they say that the actual numbers are likely much higher. The highest number of civilian deaths occurred in early 2022, particularly in March, and then fluctuated over time. But what is important is that there is no clear downward trend, that the civilians' casualties still remain high. For the total fatalities, including both civilians and combatants, the official figure is not available, but estimates based on conflict event databases such as ACLED and UCDP suggest broad range of fatalities from 100,000 to 200,000 killed over the last 4 years. Because detailed vital and public health statistics are not available now, we relied on the administrative data provided by the National Health Service of Ukraine. And we used data on hospital admissions for myocardial infarction. This plot shows a clear increasing trend in the number of such admissions between 22 and 25. Men account by roughly 64%. Men account for the majority of all admissions, but the increase was particularly stronger among women, plus 80%. It's striking because, given the huge decline in female population due to outmigration. I also would like to add a few important methodological points. So these data don't reflect true incidence. They show hospitalization, inpatient admissions. Second, part of this increase in the number of hospitalization for heart attacks may be related to better digital registration of these cases, due to recent reforms introduced by NHSU, and also due to development and expansion of cardiac centers across countries, so better diagnostics. But even given all these factors into account, I think these numbers show clear growing cardiovascular burden in Ukraine during wartime. This slide compares distribution of heart attacks by age in Ukraine, Germany, and Sweden. Again, these numbers are not, the data is not fully identical across the countries. For Ukraine, hospitalization, for Germany and Sweden, incident myocardial infarction cases, but I think the levels are not comparable, but the age pattern actually remains highly informative. The main finding is that the large part of heart attacks in Ukraine, particularly among men, occurred in much younger ages, more than 50% at the age from 40 to 64, while for Germany it's about 40% and for Sweden it's less than 30%. In Sweden, 70% of male cases occurred at the age 65 and older. I cannot argue that this younger structure of patients with heart attacks in Ukraine related to the war. I don't have pre-2022 data, and I'm sure that this younger structure existed before the war, but I think that the war may now be worsening the situation. Mental health is another imprint of the war. They also used data on hospital admissions for different groups of mental disorders, particularly mood disorders such as depression, substance use disorders, including alcohol-related conditions, and also stress-related disorders, including PTSD. And we found a shift in structure of inpatient psychiatric care towards increasing share of stress-related disorders. So again, maybe part of this related to better diagnostics. Recent mental health reform introduced by NHSU, better digital registration, but taking both this increasing trend in heart attacks and also shift towards stress-related conditions, I think this reflects something deeper, particularly war-related stress. I think that all these factors, constant air attacks, sleep, shortage of sleep, constant interruption of sleep, infrastructure damage, all these factors which sometimes called the silent stress of the war, this stress actually likely is taking a serious toll on population health. I also wanted to briefly mention another important consequence of the war, which is sharp increase in severe injuries and amputations. Most these amputations occurred among combatants, but for civilians also there is a high risk because at least 20% of Ukraine's territory remains contaminated by landmines. All these amputations and disabilities actually they lead to permanent disability, and this means for healthcare high demand for prosthetics, on prosthetic service, on trained specialists, long-term care, and rehabilitation. So currently, Ukraine's healthcare system is dealing with a lot of new challenges, experience a lot of pressure. Many hospitals were damaged during the wartime, damaged or destroyed. Ukraine lost about 30% of nurses compared to 2019. And the system is overburdened in the regions with high concentration of IDPs, internally displaced persons. But nevertheless, many international experts agree that Ukrainian healthcare system, despite all these extraordinary challenges and pressures, has shown quite exceptional, quite high resilience during wartime. Ukraine health system managed to adapt to new war-related realities, of course with support from many international partners. And now the key task is not only survival, but also how to develop, how to continue the reform launched in 2017, and how to build a better and stronger post-war health system. And now let me switch to another important topic, which is population displacement. This war is characterized with enormous population mobility. It was said already that about 6 million of Ukrainians are currently living abroad and 3.7 internally displaced. The age structure of Ukrainian refugees is very selective. Only 6.5% are people at the age 65 and older. Majority, more than 60%, is in working ages, and about 30% are children below 18. And what does it mean? So I would like to talk about the problem of huge decline in child population. This map shows the number of children in July 2023 as percentage of January 2022 by region. So what we can see is the huge decline in children in eastern and southeastern regions, while in central Ukraine and in Kiev region, it remains stable or even increased. Just to explain, these numbers don't show that in central Ukraine the number of children is higher, for example, than in western Ukraine. No, it shows the relative change in child population in each region in July 2023 compared to pre-war baseline. So the war redistributed child population across the country substantially. And I think the fact that 30% of Ukrainian refugees are children, which roughly 1.8 million kids living abroad, means a lot for the current situation, but even more for the future situation. Because the effect of this loss, if the family with children don't return after the end of the war, this could create a lasting missing generation. The loss of children means even more than aging of population, the rise in the elderly population, in older population, which we expect to be, let's say, moderate. Because the loss of children has a compounding effect. Fewer children means fewer future parents and fewer future workers. And another important change in the structure of Ukraine's population is increasing imbalance between males and females. So before 2022, men outnumbered women in, I think, by the age of 35, 40, but now due to this large out-migration of women abroad, men outnumbered women up to the age 60. So we have fewer women in reproductive ages, which also means a lot for Ukraine's post-war recovery because it can further reduce fertility. So one of the key questions, if refugee return. The survey, the BIB FREDA panel survey on Ukrainian refugees in Germany, which Germany is the largest hosting country with 1.3 Ukrainian refugees staying there. So the result of this survey shows that 45% in 2025 say that they want to stay permanently in Germany, compared to 25 in 2022. But what is important is that about 20 to 25% still don't know and still remain undecided. Return intentions heavily depend on partner location, whether in Ukraine or in Germany, on presence of children, and also on education and skills. So Ukraine's future population, in my opinion, will depend on these main factors: how long the war continues, how quickly the economy and housing are rebuilt, and to which extent displaced population return home. Also, demographic and family policy priorities are also important. Thank you very much for your attention. Sorry for my voice.
Thank you, Nataliia, for your comprehensive review of the demographic and health situation in Ukraine. I have just one comment. It would have been helpful to have an H6 pyramid, even hypothetical, the current situation, and maybe before the war, that would be helpful. And I would like to mention a topic that was not mentioned in your presentation, that's international migration. I think the experience tells us that when people go abroad, the probability of returning, like after the war, is actually very low. Effort will be to try to bring the family out of Ukraine to join them abroad instead of returning and join the family in Ukraine. And I think this survey data is probably over-optimistic. It's not really realistic. So I think the only mechanism left for Ukraine is international migration, Ukrainian demographic and labor force situation. But that's based on two assumptions. Number one, if the war ends and we have a period of stability, even a few years, and if there is a concerted effort of reconstruction, there's going to be tremendous demand of labor force not available in Ukraine. And given the wide borders of Ukraine, Ukraine will be inundated by thousands and thousands of illegal migrants from Asia, even from Africa. I think that's a given those assumptions. So the only question is, how will Ukraine handle that situation? Because we know from the example of countries in Western Europe, if you don't have a good migration policy, sooner or later you'll have tremendous problems within the country, social, economic, etc. And that is likely to happen in Ukraine if there isn't a concerted effort to develop a migration policy. Now, there are two types of migration, I think. One is the more permanent type, to try to alleviate what was illustrated, the demographic crisis, that we need to lower the loss of the negative growth and to try to remedy to some degree the age-sex structure anomalies illustrated by your presentation. And then you have the temporary migration, where you have people coming under contract to do certain jobs and then return to their own country. Now, each of those has challenges. For the first one, you have challenges of economic support. You have challenges, you have need to some criteria, you have to select those migrants. And you may have problems with acceptance of the native population of these very different type of people come. As far as the temporary migration, one problem that we see in other countries is that you may have problems of corruption and exploitation. So the challenges, I think, that this poses, number one, the Ukrainian government should recognize the seriousness of the situation and the unavoidability of this illegal migration into the country, try to create a task force to develop a migration policy, and try to reach out to countries that have been successful with the migration policies like Canada and Australia, for example. And probably the most important one is mentioned by Professor Danieri this morning, security challenges. Where you have this massive income of people, they're challenged to try to vet those people so they don't have infiltration within the country is enormous. But I think it's important to recognize that this is a problem that is very real, and if the government of Ukraine does not start preparing for that, it may be much more difficult to deal with that much later. So my question to you, Nataliia, is my perception is that currently the government of Ukraine is not really aware of the seriousness of this problem, and it is not taking significant steps to try to do something about it. Is that a correct assessment?
Okay, we can, because you need to leave soon, we will give you an opportunity, Nataliia, to respond. Could I add one quick question, which is, and this picks up on something that Oleh said, which is in your, I think it was your third slide, but you were showing the pre-war demographic trends in the pre-invasion demographic trends in Ukraine, I think up to 2019. And as you showed, there was a very significant decline already in the population, which is true of many European countries. It's almost a ubiquitous phenomenon in Europe and parts of East Asia too. The question I have is, you showed average, you had there figures for average life expectancy, and you showed that there was a very significant discrepancy of 10 years. But unlike in most countries where that 10 years would be males or lower, you were showing that females were the ones who were around 66 years versus 76 for males. Was that a mistake, or is there something that lies behind that?
Thank you very much for all your comments. And let me start probably with the first question. Yes, definitely that's a mistake. Thank you for noticing that, because of course for females life expectancy is higher, so it's about 76, while for males it's 66.
Okay,
so that's clearly a mistake. Yes, that's true. And continue with comments, with Oleh comments. I would like, probably let me start with this. So there are three main demographic components that may affect and actually form the population dynamics and affect population size: fertility, mortality and life expectancy, and migration. And let me just briefly comment on each of them, because they all three are important in Ukraine's context, but the effect on population size and the structure of population is different. So when we are talking about mortality and population health, it's important, but it matters more for health improvement, matters more for labor force, for structure of population, for sustainability, of course, productivity of labor force. But it cannot stop population decline itself. Even a large increase in life expectancy will translate in a very modest changes in population decline. So when we are talking about fertility, it's really important in the long run, because this means that the children then become future parents, and the effect is substantial. But what Ukrainian experience and also international experience show that family welfare policy can boost fertility, but the effect is short term. In other words, all these benefits can motivate people just to change the timing when they want to give birth, when they want to have children, but they cannot change the total number of children that people want. So it's just tempo effect. So it's short term, but migration is the only factor which capable in a very fast and effective way affect population size. I agree with Oleh that migration factor is very important. And in this regard, I would like to tell that Ukrainian government still is concerned with that. And probably I would refer to two official documents. One official document, because it's already approved by Ukrainian government, which is demographic strategy, approved a year ago. And now our Ministry of Social Policy and my home institute in Kiev are working on migration strategy policy up to 2035. And as far as I know, there are three priorities. The first priority is how to motivate Ukrainian refugees staying abroad, return home. So this is very important because they want to create conditions for the voluntary safe return of refugees to Ukraine. The second is motivate Ukrainians, motivate people, attract immigrants with Ukrainian origin to come to Ukraine, to stay permanently. And the third one is to motivate immigrants, foreigners from other countries to come to Ukraine and stay permanently. This is the list of priorities as far as I know. And a lot of measures are proposed. So, and I would agree with this order.
Okay. Thank you very much, Nataliia, and Oleh.